a patient comes to us for diagnosis of breast cancer, we perform the biopsy and arrange for personal follow-up and consultation after that diagnosis. It gives us an opportunity to discuss the results with the patient in person and subsequently arrange for follow-up. That next visit is typically with a surgeon. Every time the patient comes to us for diagnosis and workup, we want that patient to leave with the next step in the workup. So they have a follow-up appointment and they know where they're going next. So for every newly diagnosed breast cancer patient, one of the first steps is to send that patient to see one of our surgical specialists. Our surgical team works very closely with the rest of the Gibbs Cancer Center team to organize and refine the treatment plan that will be developed for each patient. Every patient diagnosed with cancer gets a unique treatment plan specifically for her. Different patients have different needs, and the surgical oncologist plays a central role in formulating that treatment plan.
A multidisciplinary conference is an opportunity for all the physicians caring for the patient to get together and discuss the patient's care. At the MDCs at Gibbs, not only are there physicians from all of the specialties involved in the patient's diagnosis and treatment, from pathologists and radiologists to surgeons and oncologists, but in addition, there's other healthcare workers that are integrally involved in the patient's care. That includes a genetic counselor who will determine if the patient may benefit from genetic counseling and possibly testing for a hereditary cancer syndrome, clinical research nurses who will determine if a patient may be eligible for a clinical trial, and social workers who ensure that all of a patient's needs are being addressed. The role of the pathologist is really to discuss the biology of the tumor, because not all breast cancers are the same, and to discuss results of tests that we routinely perform on all breast cancers that determine whether patients will benefit from certain types of chemotherapy or not.
The breast navigation staff represent one of the assets that we have for our patients who are newly diagnosed with breast cancer. It's a shoulder to lean on, maybe somebody to help explain a confusing procedure, maybe somebody who you can call in a moment of crisis when you're not sure where to go next. When my own mother was diagnosed with breast cancer, Kirsten Beaker was one of the navigators that helped her, and that was really an invaluable service that Kirsten helped her with. My mother greatly valued her friendship, her professionalism, and I know that our patients now also greatly value the input from our nurse navigators.
So radiation therapy is high energy x-rays. They're similar to the x-rays for a chest x-ray or an ankle x-ray, but they're high energy, and so they're actually able to kill cancer cells. They're very useful in treating breast tumors after the surgeon has done a lumpectomy or a mastectomy to kill any cells that could be remaining in a woman's body. Generally, breast cancer patients receive fractionated standard radiation with blocks to shield the radiation from the heart and lungs. The machine that they're treated on is generally an Encore or a TrueBeam, depending on what center they receive treatment. And we have radiation centers throughout Spartanburg County to be close to where a woman lives. Another kind of treatment for breast cancer is hormonal therapy. So some women's tumors have a growth factor with estrogen, and so by blocking estrogen in a woman's body, you can make it a less friendly place for a breast cancer to recur or to grow in the first place. The first and oldest drug is tamoxifen, which is still widely used today because it's so effective.
Chemotherapy is medicine that is usually given through the veins to help kill cancer cells wherever they may have spread in the body or in a localized place. Some forms of chemotherapy are actually given in a pill form, or they may be given in an intravenous form. But the idea is to reduce the risk of the spread of cancer cells throughout the body by giving chemotherapy. Your decision to give chemotherapy is really based on your risk of recurrence. So not all patients may necessarily need chemotherapy after they are diagnosed with cancer. The decision to give chemotherapy is based on an individual decision based on a patient's stage, which is how advanced their disease is at the time that we find it, as well as what we think a patient's risk of recurrence is. Chemotherapy is primarily given to reduce a patient's risk of their cancer coming back. And so we don't give chemotherapy to every patient unless we are concerned that the risk of their disease coming back is significant enough to want to reduce it with medicine. Most chemotherapy given for the diagnosis of breast cancer usually lasts between 3 to 6 months, but may be shorter or longer based on the type of chemotherapy that an individual may need to receive. Some of the most common side effects that patients become concerned about is that it may suppress your immune system. Some chemotherapy does cause hair loss, but not all chemotherapy. Some cause nausea, although nowadays we have multiple medications that may help reduce the risk of nausea. A lot of chemotherapies nowadays have less side effects than they used to.
Clinical trials are incredibly important for our breast cancer patients because they help us to refine the care that's recommended for each patient. This is not just about personal medicine, this is about precision medicine. The high-tech tests and treatments that we have, like breast MRI, fancy chemotherapy, we figure out how to employ those tools in the most efficient way by using clinical trials. Clinical trials are incredibly important. We wouldn't have screening mammography without the existence of clinical trials. The results of those clinical trials today will impact the care and treatment of patients in years to come. You may help influence the treatment of the patient sitting next to you at your table today.
We are blessed in our community to have the Beard and Josie Breast Health Center and have the resources where women can obtain mammograms for free if necessary. There's also mobile mammography, which makes it much more accessible for women to have their mammograms done. Certainly staying on top of your health and getting your mammograms annually is extremely important. I also advocate that women do breast self-exams on a monthly basis to keep check on anything that might be abnormal, and certainly if you find something, to of course bring it to your provider's attention. Certainly taking care of your body and your health is the most important thing, and we are here to help with that process every step of the way.
I would just like to say how impressed I've been with the women I've met, the breast cancer survivors in the Spartanburg community, and how giving they've been with their time, with their money, with their energy, going out into the community and fundraising for the Beard and Josie Breast Center, encouraging other women to get screening mammograms, and just sharing their stories of breast cancer survival and easing other women's fears who may be facing a new diagnosis of breast cancer. These women are living proof that there's life after breast cancer, and they're truly inspirational.
I learn a lot from my patients every day. I learn about how to be strong and how to face uncertainty, and it's really an honor to work with them every day. I feel really lucky to come to work and work with an amazing staff, but also some really amazing patients who share their story with me.
So I know that this is Breast Cancer Awareness Month, but one of the most important things to remember actually is go out and get your mammogram. Most women now have mammography covered as a free screening service, and for most of you, the calendar year will run out in December. So just remember, mammograms save lives.